Welcome back to the Wellness Cues, your place for simple health tips to protect your body and mind. Today, we're diving into 9 silent stroke symptoms you should never ignore. Let's get started. Number 1, sudden numbness or weakness in the face or limbs. One of the most telling yet often overlooked symptoms of a stroke is sudden numbness or weakness, especially if it affects only one side of the body. Imagine waking up and realizing that one side of your face feels heavy, or your arm just won't respond the way it usually does. This isn't just ordinary fatigue. A stroke can cut off blood supply to parts of the brain responsible for movement and sensation, causing this rapid change. Many people dismiss it as sleeping on the arm wrong or a pinched nerve. But the truth is, these symptoms can signal something much more dangerous. If your face starts drooping on one side, or you find it hard to lift both arms equally, that's a red flag. The scary part is that this symptom can appear subtly at first, perhaps just as a tingling or mild weakness that comes and goes. But if you ignore it, the risk escalates quickly. Recognizing this sign and getting medical help fast could mean the difference between recovery and permanent disability. Number 2, difficulty speaking or understanding speech. Another silent but serious warning sign is sudden trouble with speech. You might find yourself slurring words, struggling to form sentences, or not understanding what others are saying. This happens because a stroke often affects the part of the brain that controls language. People may chalk this up to tiredness or being flustered, but when it strikes out of nowhere, it can be a sign of reduced blood flow to critical brain regions. Some describe it as having the right words in their head, but being unable to get them out. Others might hear someone talking clearly, but it sounds like a foreign language or gibberish. What makes this so dangerous is how easily it can be overlooked, especially if it improves after a few minutes. That improvement could actually be a transient ischemic attack, often called a mini-stroke, which is a huge warning that a major stroke might follow. If your speech suddenly becomes jumbled or you can't understand others, don't wait it out. Seek emergency care immediately. Number 3, blurred or distorted vision in one or both eyes. A stroke can also affect your vision in surprising ways. Some people suddenly lose sight in one eye, while others experience double vision, blurred vision, or even tunnel vision. This happens when blood supply to the brain's visual processing centers is disrupted. The symptom can be subtle, like a patch of blurriness, or dramatic, such as total blindness in one eye. It may come and go within minutes, which is why many dismiss it as eye strain or fatigue. But vision problems out of the blue are never normal. Imagine trying to read a sign and realizing you can only see half the words, or noticing that one eye isn't registering what the other is. These are silent but powerful signals that something serious is happening in your brain. Ignoring them is risky because strokes that impact vision can quickly become disabling. Getting medical attention right away can sometimes restore your sight, but only if it's caught in time. Number 4, sudden trouble walking or loss of balance. Have you ever felt dizzy or clumsy for no reason? While occasional dizziness can come from dehydration or low blood sugar, when it's sudden and severe, it might be a stroke symptom. The brain regions that control coordination and balance can be affected during a stroke, making simple tasks like walking, standing up, or even reaching for something incredibly difficult. People often describe it as feeling drunk without drinking, staggering, or being unable to stand steady. This loss of balance can happen without warning, and it's particularly dangerous because it increases the risk of falls and injuries. Some dismiss it as vertigo or an inner ear problem, but the timing and severity make all the difference. If you suddenly can't walk straight, feel like the room is spinning, or lose coordination in your hands and legs, don't ignore it. Your brain could be crying out for help, and every second matters. Number 5, a sudden severe headache with no known cause. Headaches are common, but a stroke-related headache is very different. It often comes on suddenly, intensely, and without warning. Many describe it as the worst headache of their life. Unlike regular headaches or migraines, This one can be accompanied by nausea, vomiting, dizziness, or changes in consciousness. It can feel like a bolt of lightning in the head, signaling a hemorrhagic stroke, where a blood vessel in the brain has ruptured. People might assume it's just stress, dehydration, or tension, but when the pain is sharp and unusual, it should not be brushed off. The danger lies in waiting it out at home, hoping it passes. If you ever feel a sudden, severe headache unlike anything you've experienced before, treat it as a medical emergency. Quick action can save not only your life, but also prevent permanent damage to your brain. Number 6. Sudden confusion or trouble concentrating. Another silent warning sign is sudden mental fog. Imagine being in the middle of a conversation and suddenly struggling to remember where you are, what you're saying, or even who you're talking to. This can be terrifying, yet it's often overlooked as stress, exhaustion, or even aging. Strokes can cut off blood flow to areas of the brain responsible for memory, thinking, and decision-making. This can result in confusion, disorientation, or an inability to follow a sequence of steps. It's especially dangerous because it can be mistaken for dementia or just a bad day. If you or someone you know suddenly becomes confused, can't follow instructions, or appears mentally disconnected, it's a clear red flag. Time is critical because brain cells are dying with each passing minute, and early treatment could mean full recovery instead of long-term impairment. Number 7. Sudden difficulty swallowing. Difficulty swallowing, known as dysphagia, is another surprising stroke symptom. It happens when the muscles that control swallowing are weakened or paralyzed due to a lack of blood flow in the brain. This can make eating or drinking suddenly challenging, and in some cases, dangerous because of the risk of choking. People may feel like food is getting stuck in their throat, or that they're coughing frequently when trying to drink water. While swallowing issues might seem minor, they are a serious signal of neurological damage. Ignoring them can lead to further complications, such as aspiration, pneumonia. If you ever find that swallowing becomes difficult all of a sudden, take it seriously. It could be your body's way of warning that a stroke is happening or about to happen, and immediate medical care is essential. Number 8. Nausea, vomiting, or dizziness out of nowhere. While stomach bugs and food poisoning can cause nausea and vomiting, when these symptoms appear suddenly without explanation, they could indicate a stroke. This is especially true when accompanied by dizziness, loss of coordination, or confusion. Strokes affecting the cerebellum, the part of the brain that controls balance, are particularly likely to cause these symptoms. Many people never connect nausea or vomiting with a stroke, which is why this sign is so dangerous. The onset is often abrupt, and it can be intense enough to make standing or walking impossible. If nausea strikes alongside other signs such as vision changes or weakness, it's even more critical to act fast. Don't dismiss these as random stomach issues, especially if you've never experienced something like it before. Number 9. Temporary loss of consciousness or seizures. The final silent but alarming symptom is fainting or experiencing seizures out of the blue. While not everyone associates these with strokes, they can happen when blood flow to the brain is severely disrupted. A person might suddenly collapse, lose awareness of their surroundings, or experience uncontrollable movements. This often frightens both the person experiencing it and those around them, but it's sometimes dismissed as stress, exhaustion, or dehydration. The truth is that fainting or seizures without a prior history can point to a serious brain event like a stroke. If someone loses consciousness or has seizure-like symptoms unexpectedly, emergency help is absolutely necessary. Don't wait to see if it happens again. Each episode increases the chance of lasting brain damage or even death. Those were 9 silent stroke symptoms you should never ignore. Your health is your greatest investment, so pay attention to these warning signs and act quickly if they ever happen. Thanks for watching The Wellness Cues. Please like, share, and subscribe for more health tips, and I'll see you in the next video.